Your testosterone level is the issue in you, along with some of those other things. Your testosterone level is like that of a at least 80-year-old woman. My mother, I know she won't mind me saying what her testosterone level is, and she's 78 years old, and her testosterone level was 30.
Wow.
Right? So I showed this other lady who is 98 years old, and hers is 32, and she used a roller walker. Granted,
so what makes my testosterone level drop so low?
So I don't know what makes yours, but I can tell you what makes people's testosterone levels drop low. The perimenopause all the time. Yes, your testosterone levels drop low because your ovaries do make a small amount of testosterone. What's happening with more and more people and younger people, because I'm seeing young people in their 20s with testosterone levels like this, which is what makes me exceedingly passionate about it, because I'm trying to ring the alarm, and other doctors are also trying to ring the alarm that there's something wrong. But what is also happening in our lives is that we're having more adrenaline and more cortisol secretion because our lives are very stressful. And maybe it's not stress that we're even interpreting as stress. Like even the video games, it rises our adrenaline levels. And so when you increase your adrenaline and you increase your cortisol, what that does is it suppresses testosterone. So you're happily barely playing your video games and you're getting like freaked out and with the adrenaline rush, right? Or you whatever it is that you do, that you're adrenaline junkie, but it's having a bad effect. Even porn, right? Like with guys, porn gives you an adrenaline rush, but it suppresses your testosterone. And I'm seeing a crap load of men with like low testosterone, and they're trying to figure out how the hell did this happen to them. So there are a lot of things in our lifestyle. Yes, it's very interesting. Now, the other thing that happens to us is, which makes you very interesting, which I'd like to bring out the point, is that you have PCOS. And I took the liberty of discussing this with your doctor yesterday, that as a PCOS patient, your sex hormone binding globulin is likely also higher than the normal woman, which means even though you're 12, your body's probably not seeing very much testosterone at all because your body's binding up the testosterone. Now, for all women after they have babies, our sex hormone binding globulin actually increases. And our sex hormone binding globulin increases because what your body, when you have a baby, it becomes exceedingly stressful. And your body then produces a sex hormone binding globulin, so you can just take care of these children and not go on to have another child. So the sex hormone binding globulin, it binds up your testosterone, so your sex drive decreases. So your body's trying to preserve you from having too many other babies, so you can take care of the one that you have, right? So then
but my body needs to catch up because I tied my tubes so I could have enough sex now, but it not working. It not working.
Right. But our lives are so stressful. The news is stressful. In traffic is stressful. People who are rude to us is stressful. And I tell you what happened is it's that ancestrally, stress would be a wild beast chasing us, right? Some saber-toothed tiger chasing you. Your body can't tell the difference between somebody being rude to you or you're in traffic and like one of the kids like tried to swipe. I remember when I was in Jamaica, try to wipe my thing. And you're like, no, don't wipe my thing. And then they would like put the wiper things like up in the air, like to and I'm so pissed. Those things drive up your adrenaline, and then you are thinking, your body's thinking, oh, saber-tooth tiger is coming after you. When it's like, no, it's not a big deal, right?
Yeah. No, that's so true.
Right. So when you react from somebody's rude to you, like at the supermarket, right? Your friend like double cross you, and you get yourself like all thing, right? Or you're watching a show and it bothers you and your adrenaline goes up. All of those things are decreasing our testosterone levels. So our lives are really what's doing it, right? So I don't know what it is in you, but it can be a variety of things and a combination of things. And then we had talked before as well about the foods that we're eating also being endocrine disruptors. They are in of themselves suppressing testosterone. right? So that's the lay of the land. So the lay of the land is that you feel like an older woman because you're hormonally an older woman. But what is amazing about you is that that tells me what your drive is that you still look good, because really with this testosterone, you should be big and fat. You should be not want to come out of your bed in the days. Your husband should be complaining about you because you don't want nothing, you don't want to clean up the house. And this is what is affecting people's marriages. So when I say as a physician, it has really just made practicing medicine so much more amazing, is that I'm restoring people's marriages because I can explain what's going on and help to change behaviors, because it's not the person doesn't want to do it. It's that they just can't do it.
Can't. Exactly. That's what people don't understand.
Right.
You know what I mean? I don't want to be anxiety riddled. I don't want to open my eyes and feel like doom and gloom. I'm just want to ball the day away. I don't want to stay stuck in the bed. I don't want to tell my husband, no, I don't feel for sex tonight. Maybe tomorrow night. Maybe next week. I don't want to do that. You know what I mean? Right. And that's what a lot of women are sharing with me. The struggle is real.
Right. And they're feeling the same way, and they don't know why, and they just kind of think that's just how I am. But no, it's actually not just how you are. It's in some women, that's just how they are. But in most women, to be honest,
there's a reason.
That's not just how they are. And once you change these things that we are looking at, optimize your vitamins, optimize your vitamin D, and the other thing actually that actually helps to decrease your adrenaline and decrease your cortisol is being out in nature. So those things restore your adrenaline and your cortisol and backs up the suppressive aspect of those things on your testosterone. And even though you look as fantastic as you do, I see a lot of people who look like you with PCOS and have a hemoglobin A1C that's elevated and is pre-diabetic because their testosterone levels are so low. So the testosterone also sensitizes you to insulin and makes the glucose go into the cells properly and helps your metabolism in general. The testosterone also helps you to have more muscle mass. So optimizing your testosterone is going to make your metabolism better. Your belly fat is going to get less. The fat content that you have are all over you is going to be less, and you're going to be able to retain your muscle when you work out, which I imagine you're working out, and sometimes you must be going, for the amount that I'm working out, I should be looking better. Yeah.
And the thing is, I know I eat enough. I know my eating is not the greatest, but with the amount of exercise I do, and with naturally how strong I am and how intense my workouts are, I could look like a friggin' bodybuilder.
Right.
And I am still very round and soft.
And you will. So it will be amazing for your followers to really see that transformation, right? This is what makes testosterone is what makes the difference between that awful perimenopausal time and a doable perimenopausal time. Because yes, when your estrogen does fall off, there will be more aches and pains, because testosterone and estrogen are natural anti-inflammatories, right? And that's what all that body aches and pains and the inability to recover and the injuries that you've been getting, even those are related to what's happening now.
That is interesting. Yeah. So the testosterone that you prescribe, there was something you spoke about, bioidentical. I don't know anything about how the hormones are made, because people are just like, oh, the HRT is bad for you, oh, Shani, but really research the testosterone that she's going to be prescribing for you, because there's so many side effects, and I'm going to be honest with you, I'm not a huge researcher. I'm not going to be researching every type of, I'm one of those that the doctor prescribed me. I do a general, okay, what is this, but I'm not delving deep into journal studies on this shit.
Yeah, let us talk about it. So all testosterones are not created equal. That's the first thing. And even when you go on the internet, and even some doctors confuse and conflate all estrogens to be the same and all testosterones to be the same. The testosterones that are pharmaceutically derived are not natural. They do not fit into our receptor as a lock does with a key, which is really what a hormone should do with a receptor. It should be the key that fits into the hole and it turns it nice and smooth, and you open the door, and whatever needs to happen on the other side happens. With pharmaceutical derived hormones, the key does go into the lock, but it don't fit quite, and you have to kind of toggle it to get it open, and it will open. But that toggling is actually where the side effects are kind of coming from. So yes, if you had asked me this question 10 years ago, I would have said, like, stay away from hormones completely. And I would, as a woman, not have gone into delve with that, because yes, pharmaceutically derived hormones do come with the risk of stroke, heart attack, cancers. Like, those are the really important.
Or just like birth control pills. Those are the same symptoms of birth control pills.
Right. Exactly, which are pharmaceutically derived, and blood clots, in your legs, and pulmonary embolism. Those are they're pretty much the same. Your bioidentical is really we're not giving you something that's different, molecularly different from what is in your body. What I'm doing is I'm having you go from I'm not having you go into that dip. I'm just going to have you be level as you go into menopause. The bioidentical ones that come from soy and yam, they have the identical structure to us, right? So they cannot be branded because they are of nature, right? A combination between the blood work and how you're feeling tells us if we have the right dose for you, because we're going to be giving you the smallest dose possible for you to get effect. We're not trying to like juice you up to get bigger muscles or make you sex up. Like sometimes men like want to get more testosterone so they can just like have whole orgasms and stuff. Like that's not what we're doing.
I'm not averse to that part. I'm not averse.
Right? But you're just going to go back to what you were like in your 20s, right? That kind of sex drive, that kind of interest in sex. So you can kind of feel like not teenagerish, but like how you felt when your body wanted you to have kids, because that's really what sex drive is for.
Before I had children. Yes.
Right. That's what's going to come back. Right. There you go.
My husband always go, but before you had kids, you were the aggressor. You were the one who always wanted to have sex. I'm like, yeah, you said the right thing. Before children, before me did stress out, before I was.
Right. And you would have been the aggressor, because people who have PCOS have more testosterone than the usual woman.
Mm-hmm.
So this is exceedingly low for you. That's why you're even the way you are, because this is your body's in crisis level as it pertains to testosterone. This is not where you ordinarily were functioning in your teenage years, in your 20s, until you had kids. So this is what's going on. Yeah, once you understand the hormones, it becomes very, very, very understandable. Women fear it. They don't realize that we have it, that we need it. That is not just men who have it. And these are the things that happen. It's not just about the sex. It is the pain, right? The inability to recover after you work out, inability to recover after you've worked hard. It's, you can't get out of bed after you've worked like a serious shift, because you need the testosterone to recover. You need the testosterone to sleep. So if you don't have testosterone. Testosterone is what brings us down, right? Men tend to be calmer. It's very important for me to get the levels, because I'm giving you the minimal that you need, and I'm going to put that into a formula, and you're going to get the minimal amount. If after I give that to you, you don't respond, then I give you a little bit more and a little bit more. But usually the minimal amount is what's needed. And I dose that based on your age, your weight, and I'm replacing you. I'm not dosing you to some super, or
no, we're not upon that. Yes.
Right. You're just trying to put your testosterone back to what you were naturally in your 20s and 30s. So
my natural.
Exactly. Your natural, right? And your natural wouldn't be what my natural is, or any other natural. So it's very tailored what we're doing, right?